Well, hello everyone, and welcome to our virtual speaker series. We're spotlighting deaf and hard of hearing healthcare professionals for our healthcare system transformation project under the RICDHH, Rhode Island Commission on the Deaf and Hard of Hearing. My name is Christine West, and I'm the project manager for the HSTP project. And joining us today is Dr. Neil Leahey. Thank you for joining us and welcome, Neil. Hi there. As you said, my name is Neil Leahey and I'm a DMD. I'm a dentist and I work in Rhode Island. My office is located in Pawtucket, Rhode Island, and I'm right near the Massachusetts border. The town of Attleboro is right across the border from my office in Pawtucket. That's great. Well, we're very lucky to have Neil joining us today. We are very interested in meeting healthcare professionals from all over the country, but today we are actually able to interview someone from our area, which is so fortunate. So Neil, I have a number of questions for you. You call yourself Dr. Moeller. Where did you get that name? How did you get that? Yes. After I graduated from dental school, I started making contacts with people on the internet, and everyone had a screen name and so forth, some way of identifying themselves. And so I just came up with, I wanted something to do with teeth and something that showed that I was official, a doctor. So I came up with that, Dr. Moeller, and I've been using it ever since as my ID for emails and vlogs and so forth. Oh, that's great. I love it. I'm just wondering, Neil, how many deaf and hard of hearing dentists are there in the U.S.? Do you have any idea how many there are in the entire country? Well, I know when I started out in '93, I could probably name about 3 dentists at that time. We do have more now. Between '93 and '96, I learned about 4 more dentists. And as the years progressed, there were more dentists. I know we have some in DC, St. Louis. I know that there's one in New Hampshire, and there will be another one there soon. Also New York, and soon another one in New York. So altogether, I want to say maybe about 10 or 11 dentists that I'm aware of who are deaf in the United States. I believe that as well there are hard of hearing dentists or dentists who have lost their hearing later in life. And occasionally I'll hear from people. They'll contact me and we'll talk about dentistry. But like I said, there are probably about 10 dentists who are actually deaf. I wonder if you could share a little bit about your background, where you were born and raised, and how you actually became a dentist. What made you decide you wanted to be a dentist? And where did you go to college? What did you study? Where did you go to dental school? Tell us about your experience in dental school and what that was like for you, probably being the only deaf person in an all-hearing environment. What kinds of accommodations did you request? Interpreters or cart? Could you just tell us your story of your journey? Well, I'll start from the beginning. I was actually born in California. Didn't live there for very long. My parents are from here, from the New England area. So they were in California for work. And that's why I was born there. But then they decided to move back east. So I was raised in Massachusetts. And my parents discovered that I was deaf fairly late. They weren't quite sure what to do about it. This was a long time ago in the 60s. They had been finding out a little bit about schools, and they ended up picking an oral school for me, which I attended for several years. And then I was put in a mainstream high school for my last 3 years of high school. I had already decided I wanted to be a dentist by that time. I love things to do with hands. I love using my hands, touching things, building things. I love science. I'm just fascinated by it. And when I liked going to the dentist. I really enjoyed it. It was fascinating to me. So really, by the time I was 12 years old, I was sure I wanted to be a dentist. You wanted to be a dentist even though it was a painful experience? Well, it was already something that I wanted to do. So it was a choice that I had already made. And again, like I said, by the time I was 12 years old, I was sure that I wanted to be a dentist. It just was kind of in the back of my mind my entire life. I never really stopped thinking about it through high school. I took biology classes in college. I went to RIT and I studied biology. And even then, I thought about becoming a dentist. And I studied biology, and then I decided to make a change. I knew I wanted to become a dentist. I wasn't quite sure what I would have to do to get there. This is in the 90s, or rather the 70s. I didn't know anyone who I could talk to. There were some deaf doctors, but not many of them. This was before the ADA was signed. It hadn't passed yet. So I just continued with my biology studies, and I actually transferred to Boston University. So I spent my junior and senior year there. And I was right near a dental school. Tufts Dental School was practically across the street. So I realized I had an opportunity right in front of me. So I went and took the test to get into dental school. I did okay. And as a senior at BU, I went and took that test again. And I kind of filed it away. I didn't feel great about it. As the deadline approached, it was really time to send in my test results. And my friend who worked in the office at that school said, "You really need to send in your application, send in your test scores." And I thought, oh, well, what the heck? So I went ahead and applied and got accepted, which I couldn't believe. And I had an interview, and I was accepted to the college dental school 3 months later. If it wasn't for that friend pushing me, if I hadn't been there that day, I'm sure I would have ended up somewhere else. But I happened to be in the area. I got accepted. My friend gave me that extra push, and there I was. So that was in '89. A lot of dentists don't have role models, and neither did I. I just went in, but I knew once I got into dental school, everything was fine. I was so motivated. I was even more motivated than ever. I took all the courses. You have to take 9 courses in a semester, but it didn't bother me. I was so motivated. I was passionate. So I couldn't have an interpreter all the time. I explained to them that I didn't even really need an interpreter all the time. And I was fine with note takers, usually volunteers from the class. People would take notes, which worked out well. And I said, really, what I need interpreters for are the large lecture halls. If it's a small group, I'm fine. I can manage just fine. So for me, this is not an accommodation that would work for everybody, but the accommodations I had were fine for me because, if I had to pay for interpreters, it would have been the cost of college tuition. This is before ADA, and the laws had not yet passed. So until it was decided that, ADA passed and the college provided the interpreters, I didn't request them very much, really just for lectures, and it worked out fine. I was there for 4 years, and I used interpreters whenever I needed them. And it all worked out. I was able to read the books, do the homework, use the interpreters for large lectures. I could participate in little, less smaller groups or clinical work. It really wasn't a problem. I didn't need an interpreter. Other folks might. It just so happens that I didn't. I could lip read. I could figure out ways to communicate by writing, typing, using technology, and developing communication systems that were successful. So I graduated, and it's been great. Wow. I'm wondering, as far as your journey goes, you said, did you ever have people tell you that you couldn't be a dentist? Did you ever have a really bad negative experience in your journey? Yeah, I ran into people that were negative, even in dental school. I remember my first year, there was a student who came up to me and said, do you need help? It was like my first year. We were classmates, like asking me if I needed help. And I said, if I need help, I'll let you know. And then that same person actually had to repeat the first year, and I went on to the second year. I didn't say anything about that. In the second year, another student came up to me and said, wow, you're deaf. How on earth are you going to be a dentist? Why are you going to be a dentist? It's going to be so much trouble. And I said, if you were in my shoes, what would you do if you wanted to be a dentist? You'd want to be a dentist. And people just can't picture it. Everyone thinks that dentists have to do a lot of talking, but they really don't. There are many ways where you don't really do a lot of talking. And if anytime you do need to communicate, you set up a system. It's like if somebody went to the dentist and they only spoke Spanish. You set up a system where people can understand you so that both languages are made available, whether you bring in interpreters or whatever. You can create access on a case-by-case basis. It's very doable. So I just told my classmate, I can, imagine being in my shoes. And he said, whatever. It's funny because I remember in high school, people would ask me if I could drive. And how can you drive when you're deaf? And I just thought, some people, they're just ignorant. They just don't know. And they're not living my life. If they were in my shoes, they would understand. And they would think twice before they said something like that. But, we find a way. And even in employment, I had some negative experiences. I had a job opportunity. I applied for a dental job. I made the appointment for the interview. And when I got to the interview, the person interviewing me said, well, I'm going to need to ask my staff how they're going to feel about working with a deaf person. Okay. So a week later, I got a phone call, and the guy said, no, my staff doesn't want you. They decided to hire someone else. They were uncomfortable. And back then, that was 93, 94. I tried to explain that I do know how to communicate, that I'm comfortable with myself, but other people weren't. So, you have to let those experiences go. When one door closes, another door opens, and you can't dwell in the past. You have to find the next best opportunity, and even sometimes better opportunities. So my first job, I had a network, I had a connection, people who had seen me work. And a lot of times this is how jobs are. People actually reach out for you because they've seen your work, they've heard about you, they work with someone who's worked with you. So it's word of mouth. And I explain to people how I operate, how I communicate and navigate the working world. And I have to say, though, networking is really, really crucial. I don't know how they did it in the past, how you do it when you don't have a big network. So getting that first job, in fact, my first job was in Fall River. And the dentist there, they knew my parents. So I've had kind of an easy in. It was okay. It was an okay situation. Once you're in, you think it's going to be easy down the road, but there are frustrations down the road, despite the fact that you can network. I have 2 questions for you now. I'm guessing that you have hearing patients and that you have deaf patients. And I wonder if you could talk about your communication system. You mentioned having a system, especially with hearing patients, to communicate with them. And with deaf patients, I would imagine you need a communication system as well. I mean, obviously you can use sign language, but can you talk to me more about what communication system you use with your patients? Well, right now, where I'm working, it's very, very diverse. The setting is very diverse. I work with all sorts of people who use different languages: Spanish, Portuguese, English, Chinese, and American Sign Language. So we actually can deal with all of those languages. And the patients are hearing. They use different languages themselves. We have deaf patients there. And so we have different systems to meet the needs of each type of patient, so that with deaf people, yes, of course, I can sign with them directly. With someone who speaks Spanish, I do have an assistant in the office who speaks Spanish, and that assistant will translate. You might have a dentist who's hearing but doesn't speak Spanish, and they're going to rely on their assistant. So we all need a system. Everyone needs one. Plus, there is technology, and that's really improved from the early days, 93, 94. We didn't even have computers. We didn't have the internet, and the x-rays and everything were not digital. So things were a little more challenging then than they are now, where you can display everything on a screen, where you can have your computer showing exactly what you're doing, and the patient can actually see what you're doing. And by the time they've met with you 2 or 3 times, you don't even need the technology as much. But usually the first time I start with a hearing patient, I set up a system to make it easy for them. And they're also greeted before they come in by my assistant, that they're told that I'm deaf, that we're prepared with a communication system. They always say, okay, no problem. Once they see the assistant, they're comfortable. And so by the time they meet me, they're perfectly comfortable. There's no issue. My assistant makes a big, big difference. And people see the assistant first as soon as they come into the office. So then they have a pretty good idea of what it's going to be like working with me. And I'm comfortable too. So really, it's just about fixing the communication and having no surprises. If they came in without knowing I was deaf and there was no system in place, that would be a little less comfortable for the patient. But like I said, by the first time they've met me, things just go fine the second, third, and fourth time. Having that system there for that first meeting makes all the difference. And I don't know what other doctors and dentists do. Sometimes maybe they'll have a deaf nurse. I do go to conferences every couple of years, and I learn from them what they do, what techniques they use, what sorts of communication they have. And I usually apply those in my setting. Thank you. So before you were talking about, you knew you wanted to become a dentist, even though you didn't know any deaf dentists, except for maybe one. I'm wondering now, there's an organization, AMPHL, it's a mentorship program, and I wonder if you could talk about that. Are you involved with them? Have you gotten some mentoring? And I think, there are some benefits of having a deaf or hard of hearing dentist, and maybe you could talk about some of the benefits, not only for the deaf patient, but for the general hearing population. So could you talk about mentoring and also benefits? Well, yeah, AMPHLA, that's the American Association for Deaf People with Hearing Loss, or people with hearing loss, excuse me. And There are doctors, there are dentists, nurses, veterinarians, deaf EMTs, deaf physician assistants, deaf physical therapists, deaf patient advocates, all sorts of things. We have deaf technicians, x-ray technicians, so this is a really valuable group. And for the most part, it's doctors. And there's some subgroups of vets, a small group of vets, but it's a nice, diverse group. And that mentoring program is great. And I've been involved in that before. I've been assigned people who were mentees who would contact me. And we would talk, I think maybe just 2 or 3 interactions. And that sometimes would be enough. And so I've worked with people in school. And I guess I've only done it twice now, deaf people who want to become dentists. Everyone, they can contact me when they want to. So it's on them. And then we have this organization, so we all help one another. And there's the opportunity to be mentored by different people. So, we'll have the vets with the vets and the doctors with the doctors and the dentists with the dentists. And just like hearing people do, you want to find someone that you're going to really work well with. And it's all about your preference. If you do meet with someone and like I've learned about communication systems from different people, that's very helpful. Boston actually has more activity, and Rhode Island is having more and more activity statewide about communication. A big part of communication is outreach. Some people know I'm here and some people don't. Today I had a brand new patient, and I asked the patient how they heard about me, and they said a friend of theirs told them. The friend is hearing, but that hearing friend knows sign language. And then that friend will tell someone else. So that's kind of how word gets around in the deaf community. Outreach and access are so important, and word of mouth is primary. The other way that you can find me is through the internet, but really word of mouth is the best way to hear about me. I have a lot of patients who have deaf parents. And so even though they're hearing, they can sign. And so we have no trouble communicating. In fact, several of my patients have deaf parents. And they may not be involved in the deaf community. They have their own lives, but they do know sign language, which is really interesting. So it's interesting to learn about who's in the community. And the other thing is a lot of hearing people are using fingerspelling. When I first started in '93, not a lot of people were really aware of ASL, but more and more people I'm noticing are fingerspelling or learning 1 or 2 signs like, thank you or please. It's like ASL is becoming more popular, and I'm seeing more classes being offered. Even little kids can sign. Whereas back in the early 90s, not as many people were interested in ASL. So I think the interest in ASL has really made a difference. I mean, kindergartners are learning sign language, which is really surprising. And, deaf people, there are all types of deaf people with different communication styles. Now, I wanted to talk a little bit about oral care, dental care, teeth and gums, and that sort of knowledge. When we talk about health literacy related to teeth and dental care overall, specifically for the deaf and hard of hearing community, what information do you share with them about taking care of their teeth? What sort of dental needs they may have? Because there aren't a lot of workshops for deaf people given by someone who signs. So it's hard to share information about oral health and dental issues. So what advice do you have about setting up workshops for the community or sharing that sort of information? Where should we start? Should it be taught in school, at the elementary level, or middle school, or high school? So all of that health education, what's your opinion on that in regards to dental care? Yeah, information really does need to be shared in the deaf and hard of hearing community, especially with kids or kids with deaf parents. Maybe the kids don't know their language, or vice versa. Maybe the parents are hearing and the kids are deaf, and there's not a shared language. A lot of times when I have deaf parents of my patients might be the child, I communicate with the parent and the child's not really benefiting from that conversation. And I think this is true for people who speak other spoken languages like Portuguese or Spanish. There's a communication breakdown between the children and the parents. So, yes, I really do think we need workshops where we can expose people to dental health and where the communication is direct. And people need to know where to get information. I think schools should really explicitly teach dental health, and I think parents need communication access as well. So they need to know what's out there. With deaf and hard of hearing people, I think information is just so critical. For example, a lot of people don't understand their own insurance policies. I'm constantly explaining how it works. People think it's like car insurance. You buy the car insurance and you know your liability and you know what you're going to get if there's an accident, but not all insurances are the same. And so not all benefits are the same. So that word insurance has a lot of different meanings, and dental benefits tend to be very low. They can lower your cost, of course, of dental care, but the percentages are pretty low. And it depends on your plan. Some companies have one very robust dental plan and other companies may not. So you can't compare your plan to another company's plan. A lot of times, anyone who goes to the dentist, they go to the front desk and there's a little bit of education about what this insurance covers and what it doesn't. But a lot of my patients are surprised, and then I have to explain to them. So if we could just have a workshop on dental insurance that everyone could partake in, I think that would be really, really beneficial. Also, Medicaid. Massachusetts Medicaid versus Rhode Island Medicaid, they're different. A lot of people think they're the same, but they're not. There are certain age limitations, and you can't just hand over your card and think that you're completely covered. Some people are only covered if you're 21 or over, the services are limited, whereas if you're under 21, the services might be more in depth. And also there are language barriers to reading, just like if you only could read Spanish. So when I explain to my deaf and hard of hearing patients in sign language, they do understand. But yes, a workshop on that would be fantastic. Maybe that's something we could set up in Rhode Island, a workshop that the community could learn a little bit more about dental care and insurance, like you mentioned, and probably some other things as well. I think that could be really great. Also, just the system. People need to understand about providers. There are dentists, there are doctors, and there are other providers. And you want to go to someone that you can communicate with. If you're at your doctor's office and you have a dental emergency, a lot of times they send you to the ER. And that is not where you want to go. You want to go to a dentist. So we need to be really better with referrals so that there's a list of people available and providers who are trained to treat your condition and who can communicate with you. But oftentimes that referral process breaks down. And this happens for hearing patients too. They end up in the ER with a dental issue when they could have gone to a dentist. So we need to make that more streamlined. And I think it's about making referrals or providing that information with some ease to the consumer. And that's about communication. If medical doctors had a relationship with a dentist and vice versa, we could refer to one another. And you can talk about how certain treatments like cancer treatment can have an impact on oral health. And that's really good to know. So for deaf and hard of hearing people, if they have cancer, they probably should go to a dentist they can communicate with. And they can certainly go to whoever they want, but we need to give that information to them. So that communication needs to be easily accessible. And I think we really could do better with creating a system. That's a good suggestion. You were talking about, I wanted to talk about COVID-19, and I'm curious, how have you changed your work? What's your everyday life like now with COVID-19? I mean, as a dentist. Yes. Back in March, I believe it was the 18th of March, that was the day that Rhode Island made an announcement that businesses had to close, that dental offices had to close because of the virus. So we did. We were closed for about 6 weeks until May 11th. And we followed state guidelines. We're in Rhode Island, so we opened May 11th. After a month and a half of being closed, we did handle emergencies. But most dental offices would handle emergencies, even though they were completely closed. I only work here a couple of times a week, so I use personal protective equipment. I'm fully covered with a mask and a gown, and then another plexiglass shield in front of me. So we have a lot of protection, plus we do social distancing. And if for the waiting room, we don't have a lot of people waiting in that waiting room, maybe 2 at the most. Once we get more people, we have them wait in their car. And we just text them to have them come in when we're ready to see them. So the front desk is up, covered by a plastic shield. It's a big change in our office. Things are really different here. And we have all sorts of PPE. So we really make sure that people are safe in the office. They can still come in, but like I said, not all at once. And so it's interesting, you know, you see people in their car and then you send them a text and you see them looking at their text and then they come into the office. So it's a change. Sometimes, you know, we're just as busy as always now that we're back. And it's really the biggest difference is the waiting room. You know, the seats are farther apart, for now anyway, until whenever. We just follow the recommendations of the Rhode Island Department of Health. Yeah, there are a lot of big changes now. I'm just curious about your knowledge of the research out there that talks about deaf and hard of hearing people and any sort of health disparities related to dental care. Do you know of any research? Could you tell me more about health disparities? Yeah, for example, do deaf and hard of hearing people tend to be more at risk for specific dental problems? Are they missing information? Is there any research about that? And if yes, I mean, what does the research say? Yes, in terms of at risk, communication is an issue and access is an issue. If a deaf person chooses a dentist, they may not have great access. If there's no interpreter available, you know, deaf people have told me their stories where they've gone to the dentist and they've asked for an interpreter, but instead they get VRI. And that a lot of times the connection isn't very good. And I've heard this story more than once, that VRI isn't reliable. A lot of times it's just not reliable. So it's better to have a live interpreter. So communication access to hearing dentists is an issue. People are willing to put up with minimal communication, but you know, for example, I had a patient who had false teeth that she didn't like. And I asked her, why didn't you get teeth that fit you better, that were more comfortable? And she said, I really wasn't given a choice. And that's something I would never do. I'll have the patient come back and I'll change their false teeth until I get the ones that are they're most comfortable with. So I explain everything. I show x-rays, I show fillings, I show a lot of pictures, and I do a lot of teaching. But I know back when I was young, I didn't really mind what they were doing to me as long as I was comfortable. But I didn't really know the ins and outs of dentistry, and that has to do with communication. So if you're okay with your dentist, that's great, but it is important to have good communication. You need to be able to ask questions. They need to be able to answer your questions. But VRI is sometimes not reliable. And, it's nice sometimes to just sit back in the chair and relax. And with a live interpreter who can move around the chair, you can relax more. VRI, you have to sit up to watch it. It's very inaccessible for dental patients, and access is really important. That makes sense. Do you have anything else that you want to add right now? Anything that I haven't asked you that you think is important for the community to know about in terms of dentistry as a healthcare profession? Is there anything you'd like to add? Well, I think I mentioned communication, access, and outreach, how important outreach is, and how that needs to, I talked about word of mouth, but sometimes really getting the word out there is just critical. And I like to make sure that people recognize my name. They need to know that I'm a deaf dentist, that I know sign language. You'll see this with doctors and nurses. Sometimes they'll put down a language that they know. They might say where they're from. It'll be a social worker, and you can say, "Oh, wow, that person may know this language." It'd be nice to have it with deaf people too, like a social worker who has a lot of deaf clients and knows about me could then refer their clients to me. Same thing with doctors and nurses. As long as they're aware of me, they can make referrals to me. So networking and really getting the word out there is crucial because, as I said, if you look in the phone book or something and you see my name, I have some people, and I do definitely make sure that it shows what insurance I accept. Some people may overlook that. It's in small print. Sometimes the directory doesn't really highlight me, or someone might have my card, and that's helpful, and that's a good way to spread the word. So there are a variety of ways that people know about us, but I think really if we had a workshop, participation is really key. People would choose to participate. And that whole thing about being in network and out of network, for example. I mean, Delta Dental is a Rhode Island dental organization, and I belong to that, and that's in network. But I also do out of network work, and that's confusing to my patients. You have to follow the procedures of each network. So that can be confusing for patients, and a lot of times they won't get the insurance they thought they were going to get or the coverage they thought they were going to get because I might not be in the network that their insurance participates in. So I try to make it clear what networks I'm in. And people say, does it mean I can't see you if I'm not in the network? And that's like, no, of course you can see me. It'll just be a different fee structure. So I do a lot of educating about insurance. Again, it's nothing like car insurance where there's just not that much to have to figure out. Medical insurance can be a little bit confusing too. I have Blue Cross, and I know there are lots and lots of details in the policy. There's a lot to read, but you need to understand your coverage. And for deaf and hard of hearing people, I think we should really talk about coverage so that when they go to a dentist and hand over their card, they're not surprised by the bill. or finding out that they're not covered, because what they have to pay, the remainder, could be very costly. So that's important that they know. Knowledge is really valuable. Yeah, absolutely. With medical professionals, when they do outreach in a community, and a bilingual community like Spanish or another language, it's so effective. And the same thing for deaf and hard of hearing people. The way to reach them is to network in the community. Starting Rhode Island with the Commission on the Deaf, maybe having a workshop and inviting people to come and talk about medical needs. So that's a good way to advertise it. That would be a great workshop. That is really a good idea. So you've talked a bit about outreach and how Rhode Island is improving, and I have to say it is improving. It's getting better and better, bringing deaf people together as a community. I like that healthcare education, because of outreach, that education could really get out there. And whether you go to medical school and learn a little bit of fingerspelling, you could outreach your patients and then refer them to me as a deaf dentist. You yourself, as a hearing person, could be a great referral. And we could set up the best communication access for patients. VRI in a dental setting, I really don't know. I did have a patient tell me, like I said, that the network was terrible, that they really couldn't have a consistent message. I've never used it myself, but and many of my patients never have. But now there are more and more deaf patients that really need sign language. And some of them are happy with writing notes with their dentist, but whatever it is, access is really, really important. I agree with you. Do you have any other things you'd like to add before we wrap up? I really appreciate talking with you. I could probably do this forever. I'm learning so much. You're learning? Oh, that's great. You're learning about dentistry. When you're interpreting, you hear a lot of vocabulary, I'm sure. Oh, one thing, do you know what the difference between DDS and MD? Well, they're different degrees, but I don't really know the difference. Well, it's like a doctor and a DO. DO versus MD. They're really the same. It's the same thing. If you think one is better than another, it's not actually true. They're really the same. They both go to medical school. They have the same curriculum. They're just different degrees, but they mean the same thing. And also, once you get to work, you have to take up courses to further your education. You have to earn CEUs to advance your learning. The more you learn, the better. So that's the CEU program is where I learned, because dental school is one thing, but there are lots of things I've never had an opportunity to study. So I do that through continuing education. And that's required. And you can learn from someone, especially a mentor, about an area of dentistry that you don't know. It's the same for medical school. There's DDS and DMD. So those are really important things, is to continue your learning and go to those CEU courses, lectures, workshops, and earn different certifications. Work with people in different areas of dentistry. Work in different groups so that you can watch and learn new techniques. I think that's really valuable. And now, where I am in Pawtucket, the owner has learned from me. The owner of this business will ask me things, and I learn from him too. Pretty often, they'll be using a different technique that he can show me, or a different technique that I can show him. So that education is a two-way street. These CEUs can be expensive, but they're really important. We'd like not to have to refer our patients out of the office. We'd like to be able to serve them in the office. So we need different skill sets. There's always learning to do. And even from someone who's just graduated dental school, because things are different now. There's a lot more information available to students now than there was before. Things are digital. In fact, nowadays, the dental schools have the best like 3D models so that you can see the entire head from every perspective. We didn't have that in my day. So that's something I find very, very useful, to have these 3D models and new technologies. It's really, really nice to see the entire skeleton on a 3D screen. So technology now in dental school, the way they're teaching it is just so much better than what I had back in my day. So students are actually learning a lot more. And I can learn from those new graduates. So there's a lot that I'll never know that they'll only know. But, you can learn from anyone at any time, even though we're all busy. CEUs can be very costly. I think one credit was something like $22, but or it could even be more, $600. It just depends. You're always paying for your CEUs. You're always learning. You're always needing more education. So you have to find different ways to further your knowledge, just like doctors do. And workshops are great. That's a great way. We have to get 40 CEUs every 2 years. And you may go to different states to get them. Some states only require 12. I think doctors, I have no idea how many CEUs they need, but we all need continuing education. You were talking about learning in CEUs. Let's say someone wanted to apply to dental school and they're deaf or hard of hearing. What advice do you have for that student? And also for dental schools, how can the school be more welcoming for deaf and hard of hearing students? So can you talk about applicants, the advice you might have, and to schools, how to be more welcoming to deaf and hard of hearing students? Well, when you apply to school, I remember, I'll never forget this. I applied to 4 different schools. Other people might apply to 8 or 10 or 12 schools, but I picked 4. Connecticut, BU, Maryland, and then Tufts, New England Medical School. I sent out my applications, and I really wasn't sure, even though I hesitated. And Tufts actually accepted me right away. And I interviewed there before I'd even heard back from the other schools. And I remember, like BU, I went with my BU interpreter. They actually provided me an interpreter for my Tufts interview because I was there, and I needed someone for my interview, and I asked that interpreter, and luckily they were happy to do it for me. So the interpreter actually had deaf parents, and I think the interpreter really understood my needs very well. And so the interpreter interpreted the interview, and one person said, why did you only apply to four dental schools? And I said, well, I wanted to be close to home. And they asked me there's a whole bunch of people in the room, and they kind of went round robin asking me questions like, what was the first dental school in America? And other people in the room didn't know. And I raised my hand and said, actually, I do know the answer. It's Baltimore, Maryland. And they were shocked that I knew that. It might have been helpful that I'd always wanted to be a dentist, and I was so fascinated with the field. So my interview went really well, and my interpreter helped me a lot. So if you're going to dental school, ask for an interpreter for your interview, because then you get feedback from the people in the group, and you can actually learn from that experience. So I recommend that. Everyone's experience is a little bit different, but Tufts accepted me right away. If you have challenges, and I'm sure doctors do as well, use an interpreter because they can really help, especially with an interview. And I just thank God that that interpreter was there for my interview. It made all the difference, and it made me comfortable. And it was only like a week later that I got my acceptance. I think, things are, I've talked to friends. I know people who work in medical offices, and I really encourage them to go to school. And I think too about my friend who pushed me to go ahead and apply. If I hadn't crossed paths with that person, that was such a lucky moment, then I never would have gotten where I am. And also having mentors and someone to talk to also really helps. Someone that you can talk to. And people say I'm brave, and I don't think of myself as brave, but I guess from their perspective I am. What I think I am is motivated. I'm excited about the work. And motivation is key. Without that, how are you ever going to be successful? You'll never get there. People say I'm brave. They ask me if my family's deaf, and no, they're not. But I really feel like, yeah, there are some negative experiences, but you can't let that stop you. You just have to keep rolling on, and you can't let it get in your way. You've got to put it to the side, and don't let it bother you. Just let it roll off your shoulders, because people need to be educated. We're always teaching and educating. It's just nonstop. Well, wow, what an inspiration, Neil. Well, okay then. I think we've covered everything. Thank you so much, Dr. Moeller, for speaking with us today. I really enjoyed this interview, and haven't seen you in so long. It's really nice to see you. I hope I see you around the community soon. Yeah, with COVID, it's really changing everything, and it's very isolating. I don't really see people. And I am the only deaf doctor in Rhode Island, so there's not a lot of opportunity to get together. But, it's the same for everyone. Everything's closed. I'm happy to have a job. Thank God for that. I have plenty of work, and everything is pretty stable and status quo for me, which is great. I don't know how long this could go on, a year, 2 years. None of us knows. I mean, how can we possibly know? Plus, we're losing people. So it's really, really hard to know what we can and can't do, but we just have to wait and see and be happy that we have our jobs. And I'm really, really grateful for that. I don't know if interpreter requests have gone up or down. No, interpreters are still working. Luckily, we are still working. Mostly remote interpreting, not so much live interpreting. But it's damaging our eyes. I'm probably going to have to go to an eye doctor because I'm on screen all the time. Yeah, eye doctors are probably getting lots of business now because of COVID-related issues with people wearing masks and their glasses are fogging up, and I'm sure the eye doctors are busy. There are deaf optometrists. I'm aware of one, and I've seen vlogs, and they've talked about the effect of the virus on eye health. So yeah, eye doctors are getting more business. It's the fogging of the eyeglasses. I'm sure of it. So I'll keep track of different meetings online. I'm always talking to people remotely, and getting different views. So it's been an interesting life. But we're going to get you in some of our meetings. We're going to get you involved in some of what we're doing here. Yeah, or like we said, we talked about workshops. And maybe, we'll have to wait to do them live, to do them in person. It's easier to teach in person. Yes, it is, definitely. Okay, perfect, Neil. Thank you so much for today. I really appreciate this, and it was good to see you. Take care of yourself and stay safe. Don't forget to wear your mask, Christine. I will, I promise.